The achroma lens Hanita is the first achromatic intraocular lens that makes it possible to enjoy vision-improving color perception by the eye and at the same time improving visual quality for far and for near. Colors are an essential step in vision. Colors make vision enjoyable. Colors give life sensation. Colors make us social. Colors make us laugh. Colors make us enjoy life. When modern intraocular lenses were created, they did not contemplate color vision. Although they have no spherical aberration and a high MTF, all conventional IOLs have a high chromatic aberration, which causes a low polychromatic MTF. MTF, when low, degrades quality of vision, specifically related to different wavelengths. As an example, the power of an intraocular lens changes according to wavelength. All intraocular lenses available today change their powers related to wavelengths and the amount of chromatic aberration. They might also experience changes in power related to different light environments. The consequence of this is a decrease in contrast sensitivity and visual quality. Here we see how an image appears with no chromatic aberration and when chromatic aberration is present. Chromatic aberration decreases the depth of field, and consequently, the elimination of chromatic aberration will increase the depth of field significantly. Based on these principles, we have created the achroma lens, which is the first achromatic lens available for human implantation. The achroma lens should lead to a higher contrast sensitivity with an increased depth of field and a higher range for centration and tilt error related to IOL position. In summary, the achroma lens is the first presbyopic achromatic monofocal lens. Presbyopic correction is achieved by increasing the depth of field and at the same time improving contrast sensitivity. The correction of chromatic aberration will create an improvement in polychromatic MTF. As an example, to change from spherical to aspheric conventional lenses increases the polychromatic MTF to 10%, while to change from aspheric to achroma lens would increase the polychromatic MTF to 40%. As a consequence of this, an increase in depth of focus will happen. When we change from spherical to aspheric conventional lenses, the depth of field is, rather than increased, decreased by 5%. However, when we change from aspheric to achromatic lenses, the increase in depth of field is 52%, which is highly remarkable. The achroma lens is manufactured by Hanita, with the ideas developed in the University of Murcia and Visum, Alicante, Spain. It is a single-piece, hydrophilic acrylic, diffractive, achromatizing, aspheric posterior chamber intraocular lens with an extremely innovative design. The achromatic IOL is based on the achromatic singlet principle. This solves the chromatic aberration problem by superimposing a diffractive surface over a generally aspherical refractive surface of a singlet. Reducing both chromatic and spherical aberrations also reduces the spherochromatic aberration caused by the change in the spherical aberration with light dispersion. It has square optics that are comparable to those best available on the market to prevent posterior capsular opacity, and is supported by an extremely stable IOL design, which is the Hanita C-Lens platform. The polychromatic aberrations, as corrected in the achroma lens, compensate those of the cornea and create an achromatic optical system in the human eye. According to these modifications in the optical design, the optical power of the lens does not change according to the different wavelengths, as this image shows. As an example, we see here how the chromatic correction influences the quality of this text when an aspheric IOL and achroma lens are compared. Here we see how the difference in color and the correction of chromatic aberration influences the quality of image of this letter A. The achroma lens is supplied in a power range from +10 to +30 diopters and is ready to be implanted through the micro-incisional cataract surgery principles through less than 1.8 millimeter incisions. Here we see the first human implantation of the first achromatic lens. The lens is properly placed in the cartridge. The lens is implanted inside the capsular bag and is properly centered by the quality of the material and the design. The achroma lens follows the principles of micro-incisional cataract surgery, MICS, as defined by Jorge ALIO, and so follows the most modern surgery approaches. This is the 24 hours post-operative appearance of the first achromatic intraocular lens implanted in a human eye, with the typical polychromatic rainbow sign of this lens characteristic of this optical design. This rainbow sign is created by the monofocal diffractive technology used for the achromatic correction of the light. Different aspects of this case show the intraocular stability that was achieved 1 month after surgery. The case was a 65-year-old lady who was operated as demonstrated before. The post-operative appearance at 1 month was the following. Here we see the corneal aberrations, and here we see the intraocular aberrations of the patient. The lens is perfectly centered, and there are no internal aberrations created by the lens. All the aberrations of the eye are created by the cornea. As shown in the wavefront analyzer, the eye is behaving without any significant aberrations, and intraocular aberrations are markedly diminished. In summary, the achroma lens is the first monofocal, achromatic intraocular lens which corrects both spherical and chromatic aberrations, increasing the depth of focus and overall optical performance of the human eye. The lens is tolerant to decentration induced by capsular bag retraction and has a high polychromatic MTF. One of the main distinguishing features of this lens is that, unlike all conventional IOLs, it does not have a focused shift along the visible spectrum. In summary, we consider that the use of polychromatic correction of light is a step forward in the development of modern intraocular lenses. The correction of chromatic aberration is a new way to improve quality of vision and creates a new type of presbyopic intraocular lens without the problems of multifocality. Already ongoing clinical studies will prove this concept and its remarkable positive consequences for human lens surgery. The enjoyment of vision will come with the enjoyment of life, as has happened throughout history. Colors are necessary for life. Color is necessary for the quality of life.